mentioned in the notes, but you should learn this also well, okay? So here you can see section of the coronal section or sagittal section of the kidney. You can see the outer cortex and the inner medulla, okay? Now the inner medulla consists of 8 to 12 pyramids. Pyramids has a base and it has an apex. The apex opens into the papilla. It's called as renal papilla. This is called renal papilla, okay? And you can see striations. Can you see these lines? Yes. These are striations. Actually, this is caused by the loop of Henle. The loop of Henle is lying like this, so it is causing these striations, gives that appearance. Okay? So here, next what we have ducts about, you have Bellini, ducts of Bellini, okay? Which open into the minor calyx. So this is the minor calyx. Then this is the major calyx over here, forming the pelvis of ureter and then callus ureter. Clear? Okay, what else we can see here? We can see, now let's talk about arteries. So this is the renal artery. This will be the segmental artery at this level. This will be the lobar artery. What is a lobe? It is a pyramid plus the cortex. This is a lobe. This is a lobe. Okay, so here it is called lobar artery. When it comes in between, it's called interlobar artery. Interlobar artery. When it comes here, it makes an arc, ismo arcuate artery. An arcuate artery, this is arcuate vein over here. It is like a border between the medulla and the cortex. After that, you have interlobular artery. What is a lobule? A renal lobule. You have medullary ray. From here, the medullary ray surrounded by interlobular blood vessels. This is called as a lobule, renal lobule. So lobe is big. This is the whole thing is called lobe, and this is called as a lobule. Is it clear? Renal lobule. Okay. So now after interlobular artery, you get what? You get afferent artery. You can see here. Can you see these arteries here? This is the afferent artery. And this is the structure of a nephron. If you notice it, you can notice the parts of the nephron over here. The PCT, loop of Henle, see, loop of Henle, and the DCT, and then opening into the collecting duct. Okay, so I hope you understand this pattern, how it is. Okay, look here. This is another very beautiful section we have. So here, this represents the cortex, and this is the medulla. Okay, so now we can see two types of nephron over here. The one which is towards the surface will be the cortical nephron. The one which is close to the medulla will be the juxtamedullary nephron. So what is this? This is the glomerulus, and this is the PCT. This is the loop of Henle, descending loop of Henle, ascending loop of Henle, DCT. Okay, opening into the collecting tubule first, then collecting duct. This is the collecting duct, which opens in the papilla, in the renal papilla. Then minor calyx, major calyx. Clear? What else we see here? You can see the relation of the nephron with the blood vessels over here. Clear? So these are all the afferent vessels. Okay, and here you can see vasa recta. These are the vasa recta blood vessels. Is it clear?
Yes.
Come to this. Again, very beautiful section model. So you can see one glomerulus. Glomerulus is made up of tuft of capillaries, and lots of capillaries, and then it is bounded by Bowman's capsule. So this artery which you're seeing now, this is the afferent artery. Afferent arteriole is 3 times larger than the efferent, if you see the diameter. Okay, so you can notice here, this is the afferent which is bringing the blood, and this is the efferent which is taking it out. Okay. Then again in histology I will be taking this. This is called something called as macula densa. Okay. So today we'll see more details. Okay. Next, coming to the what are here? These are the capillaries. Agree? Now the Bowman's capsule. Okay, Bowman's capsule. You have 2 layers over here. You have parietal layer and you have visceral layer. So which one is close to the? Yeah, parietal. And you can see the simple, what epithelium? Simple squamous epithelium. Can you see? Simple squamous. Are you able to notice? The simple squamous epithelium. Okay. So simple squamous epithelium is the parietal layer. The other layer is called visceral layer. Where is the visceral layer? Can you see this? The visceral layer of the yeah, this is also called as podocytes. So the relation of capillaries and podocytes, very close to each other. Okay, very close to each other. Agree?
Yes.
Okay. And this is where you have the glomerular filtration happening at this level. Okay. This is where you must have seen a diagram where there are 3 parts shown. Okay. Again, I will explain more. Fine. Another point. this place is called as the vascular pole. Ishusmo? Ish meaning the blood vessels are entering into the Bowman's capsule. So this is called as the vascular pole. You can see afferent and efferent over here. When you come here, this is called as the urinary pole. Urinary pole. Because the filtration of urine starts, urine is collected and starts going into the PCT. This part will be called as what? Urinary pole. And this will be called as the vascular pole. So it has two poles. Okay. Now, this is which part now? After this? PCT. Proximal convoluted tubule. Okay. So what is the epithelium? If you notice here, it is simple cuboidal. Simple cuboidal, and you can see some lines inside. Can you see? It's called striations. Okay. So there are some striations seen in the PCT. Okay. It has a brush border. It has a brush border. Okay. The DCT, it's not shown here, but the DCT, if you compare, it also has simple cuboidal epithelium, but no striations, no brush border. No brush border. Okay. So yeah, with this we can, and I stop. I finished all this.